One of the things that actually influenced me significantly towards going medicine was my father had a kidney transplant when I was a child. And to me, it was fascinating that one can get organ from someone who's deceased and helps save lives with others. And that made a significant impression on me. And that's how my interest started in medicine.
So I've been diagnosed 4 times with cancer. I was 40 years old the first time I was diagnosed with cancer, and that was a carcinoid tumor.
When I saw her first, it was a difficult time in her life being diagnosed with breast cancer and going through multiple operations. Cindy had a history of radiation to the chest, and as a result, the risk of implant reconstruction was high for complications. And as a result, we performed DIEP breast reconstruction. There are many ways to perform breast reconstruction. Specifically to replace volume, we use either implant or we can use autologous tissue or our own tissue to reconstruct the breast. And when implant reconstruction is difficult or is not preferred, then we use autologous tissue. Now, we can use autologous tissue or our own tissue to reconstruct the breast either as a pedicle flap, a flap that is close by where we can rotate and reconstruct the breast, or we use tissues that are more distant. DIEP flap, which stands for deep inferior epigastric artery perforator flap, involves using lower abdominal tissue to reconstruct the breast using microvascular surgery. We perform an excision of lower abdominal tissue and preserve the artery and the veins and move the tissues onto the chest where there's mastectomy defect and reconnect the artery and vein and perform the anastomosis using microscope, which is why it's called microvascular surgery. This procedure is much longer than implant reconstruction and a longer initial hospital stay, but long-term outcome is excellent.
Here I was able to survive cancer for the 4th time, and it touched me so much that I really wanted to do something to make the world a better place.